Welcome to The Healthline, issues that shape our well-being. I'm your host, Dr. Andrea Alt-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to welcome Farrah Mozawalla to The Healthline. Farrah has been an advocate for the Asian American community for over 20 years. For example, Farrah unified the different Asian communities in Nassau County and lobbied for the creation of the Nassau County Office of Asian American Affairs, where she served as its first executive director. Under her leadership, the office worked to make sure they could access resources and relief during the COVID pandemic. The office also tackled and analyzed emerging trends of the Asian cohort in order to ensure government policies consider Asian needs and their perspective. Upon leaving her role as the executive director of the Office of Asian American Affairs, Farrah founded the Asian American Institute for Research and Engagement, otherwise known as AAIRE, in 2022, where she serves as the CEO. AAIRE is a nonprofit on Long Island that focuses on the needs of the Pan-Asian and other marginalized populations by tackling the underrepresentation and lack of awareness regarding their health issues, and their overall issues, I should say. Also, I should mention that Farrah is a Hofstra alum. She's received her bachelor's degree and her master's degree from Hofstra. So Farrah, welcome to The Healthline.
Thank you, Dr. Alt-Brutus, for having me. I'm super excited to be here and to talk a little bit about what AAIRE does.
Great. We're really happy to have you here, too, as well. So tell us more about yourself and what led you to your passion for advocacy for Asian American communities.
My passion for advocacy stems from my personal experience being a South Asian Muslim woman living and growing up in Long Island. I witnessed firsthand the challenges and underrepresentation and lack of awareness of our communities. These experiences inspired me to create a space for the voices of the marginalized communities. We wanted them to be amplified and address the challenges that these communities faced. Through AAIRE, through the Asian American Institute, we are able to tell our story through numbers and data and help break down the barriers, especially around topics such as language access, cultural competency, health inequities, combating stereotypes within our communities also.
So I understand you created the Office of Asian American Affairs when you worked for Nassau County. Can you tell us a little bit more about your time with Nassau County? How did that experience lead you to want to create AAIRE?
I was privileged enough to advocate for one of the fastest growing communities in America. In Nassau County, the Asian population is about 11% of the population. In Suffolk County, it's about 4 to 5% of the population. And this population has increased exponentially over the past 5 to 10 years, about 150%. In Nassau County, we focused on ensuring representation, addressing inequalities, dissemination of government resources, making sure they're translated into the various Asian languages like Mandarin, Korean, Urdu, and Hindi. Basically, I was also a liaison to the community and to the county executive for advising her on issues pertaining to these different Asian communities. While I'm extremely proud of the work that we did in the county, I did realize there was a need for critical research, deeper research, and grassroots engagement. While I was in government, I realized that the Asian nonprofits that we work with in government, most of the ones on Long Island are based on, doing a lot of cultural events. They're based on one ethnicity. So you have a Chinese group or an Indian group or a Korean group, but you don't have a pan-Asian American group, a group that's unifying the entire community. And there's no real research institute on Long Island. We're the first nonprofit on Long Island for the entire Pan-Asian American community. Our focus is on the research and the advocacy. The research and advocacy, as in the county, we saw so many disparities in terms of research. Mm-hmm. For instance, the National Institute of Health allocates a budget for health research. In 2024, the budget was about $49 billion. The funding that was dedicated to the Asian American community was a very small fraction of that. It wasn't even 1% of the budget. It was like 0.17% of the budget. This one-size-fits-all approach is problematic because, there's genetic dispositions between different groups, ethnicities, and if you're basing your studies predominantly on the white population, they might not be effective on other populations in terms of drug metabolism and drug susceptibility. Asians have a unique risk, and it needs to be studied. We have diseases in terms of diabetes, cardiovascular diseases. We need more studies on these different diseases. There's a study called the Mozawalla study, which was out of the University of California and Northwestern, and it was the blueprint for addressing the health disparities within the South Asian community. So we need to focus a lot more on having these types of studies. These disparities, not just in healthcare or in the health industry, but they're in every single field that we look at. And that's really what led me to establish AAIRE. I wanted to create an organization that combines research, advocacy, and education to educate the unique challenges facing the Asian communities on Long Island.
You and I actually, we met and we both worked for Nassau County in general. I was the director of Health Equity, and you were director of the Office of Asian American Affairs. And we often talked about that, right?
Yes.
How there's so little research focused on Asian individuals living or communities living in the United States, and how more work needs to be done in that area. So thank you for highlighting that as a major issue. So with AAIRE, you do collaborate with the Hofstra's National Center for Suburban Studies. You're doing some great work right now currently with AAIRE. So tell us more about the work that you're doing, and particularly health-related work that you're doing.
One of the main projects that we've worked on in the past 2 years is a language accessibility survey. This language accessibility report was done in collaboration with the National Center for Suburban Studies at Hofstra University. We first did focus groups. We had 3 focus groups. One was with stakeholders within the East and South Asian communities. Another was with the constituents or residents of the East Asian community. And then the third one was the residents of the South Asian community. The second 2 focus groups, we had them in different languages such as Urdu, Hindi, Mandarin, and Korean. With these focus groups, we touched upon the different dynamics in terms of language barriers and what the communities were facing. What we found out in these focus groups, we created a survey, a comprehensive survey that we disseminated to the Asian population here on Long Island. We had about 400 people complete this survey. The survey was done in English, but it was also, we had translators that helped facilitate translating it to people in the various Asian dialects. What the research that we got from the survey, we had a summit on it, and we're presenting our research in this upcoming week. It should be in the different newspapers, and it's on our website. So we're hoping that people will read it and learn about the recommendations that we have proposed for this. And some of the things, like when we were dealing with the focus group, we had a lot of group participants that spoke about just different health disparities. And one of the things that came up was, I remember one of the survey participants saying that there was a lack of availability in health screenings in her community, and she didn't even understand what screenings were available. And she was wishing that there would be some sort of translation services, maybe if local healthcare institutions or governments could put advertisements or this information in their ethnic media. Because in the research that we did with the survey, we found out that about 70% of the immigrant population from the Asian community uses ethnic media. So they're not receiving the information that they need about these screenings or information in any of the spaces that we're talking about.
That's such a great study, and hopefully it leads to more advocacy work around the services that are needed in the languages that they're needed in. Can you tell us more about the other projects you have going on at AAIRE and what's on the horizon for AAIRE?
In that study we did, we found that 59% of participants reported language challenges that prevented them or their family members from accessing non-emergency health care. In that percentage, a lot of them spoke about mental health related services that they didn't even understand what those services were. So we wanted to focus a lot on mental health this year. Within the Asian community, our goal is to partner with local organizations to explain the resources available to them. We wanted to make it so there's more accessibility for these communities, dealing with people who understand their languages, the cultural competency within these communities. There's so much stigma around mental health in the communities, and we want to, break down those barriers and make sure that people understand that there's governmental resources, healthcare resources through the local healthcare providers that they could receive. One of the things I've noticed is that when we're talking to a lot of these families and the immigrant population, they're coming to America from these, they're like war-torn countries. They're coming from these impoverished areas looking to America for a better way of life. And they're bringing with them all of this baggage and trauma from the countries that they're coming from. Mm-hmm. They don't go and see a mental health counselor. Mm-hmm. They don't know how to just process all of these emotions. Mm-hmm. So we're hoping that just by us being able to provide them the support and just be a conduit to have them gain access to these different services that are already there for them. They just need to know where those services are and how to reach those services. So that's what we're hoping to do this year, is just make sure they know about the accessibility of these services.
Okay, great. That's amazing. Any other projects you have going on that you'd like to talk about?
Besides the mental health and the different aspects of mental health we're working on, we're going to be going into different school districts, talking. We work with different school districts on professional development in terms of combating anti-Asian hate and Islamophobia. We're working with the youth on doing some youth empowerment workshops. So those are our main three areas of advocacy right now.
So as we wrap up our episode for today, is there any parting words or anything you'd like to share with our audience before we wrap up this episode?
I want to just thank you for doing this and creating awareness about AAIRE and the work that we do. I want to thank the audience for listening. And if you want to learn more about AAIRE, you can just go to our website at www.aire.org.
Thank you so much, Farrah. Thank you for coming on our show today. I always love chatting with you about the needs of the Asian American community and just bringing light to them, because I think sometimes it's just not discussed enough. And also it's not a monolithic. The needs are similar, but then at the same time, there's specific needs needed for the Asian American community. So thank you for sharing with us what you're doing at AAIRE. So keep up the great work. So thank you, Farrah, for visiting us here at the Healthline and for bringing awareness to the concerns that are impacting Asian American communities here on Long Island. Thank you to our entire audience for joining us today on the Healthline. And as always, we appreciate you tuning in. My name is Dr. Andrea Alt Brutus, and have a great day.